Welcome to today's video, where we discuss why mental health and well-being are becoming essential priorities in dentistry. I'm delighted to be joined by Dr. Yvonne Shaw, Underwriting Policy Lead at Dental Protection and a board member of the NPS Foundation. Today, we'll be discussing what motivated this important commitment into supporting mental health in dentistry, the challenges facing dental professionals and students, and how these efforts could help shape a healthier, more sustainable future for the profession. Dr. Shaw, thank you for joining us. Dental Protection and the NPS Foundation were the first to sign the FDI pledge. What motivated you to take this leadership role?
Thank you and good morning. Yes, Dental Protection and the NPS Foundation were jointly aware that the deterioration in well-being and mental health of clinicians is a really significant issue, and it's impacting healthcare globally. So we hear about colleagues who are considering leaving the profession due to the levels of stress they face, and in turn the impact this has on their ability to provide optimal patient care. Now, knowing that future members of the profession are already struggling in their student years is a real concern. And that's why we're motivated to ensure it's not ignored and to look at how we can support our dental student members. On a personal level, I know how easy it is not to prioritise your own well-being and the impact that then can have on your professional and your personal life in the longer term. So for me, being a signatory represented a genuine commitment to change how the profession supports its youngest members and protects their futures.
How will the NPS Foundation's research and projects contribute to practical support for students under this pledge?
The pledge is a key milestone of a wider project that's being undertaken by the World Dental Federation, so the FDI, and the NPS Foundation are funding that. And the project aims to tackle stress and anxiety in dentistry more generally. So the project goals included promoting and extending resources and tools available to dental students so they have practical support. An important element is to remove some of the stigmas that prevent students and the wider dental team from discussing their well-being and mental health, or even just seeking help. So one example is to normalise discussions on this subject. It's a simple step, and that might help to remove some of those barriers that previously existed. I suppose for us as an organisation, Dental Protection provides its student members with access to counselling and wellbeing services, and we will ensure that dental students are signposted to practical help when it's needed. From the NPS Foundation perspective, we're committed to funding research that addresses personal and professional wellbeing, and that applies to all healthcare professionals. We're keen that projects are producing outputs that will make a difference to all of healthcare professionals, starting right from undergraduate training, continuing throughout our careers.
What are the main mental health and well-being challenges dental students face during their training and early careers?
It's a good question. And globally, there's been various studies which have looked at kind of mental health and well-being. And some of the ones that I've seen have reported that more than 50% of dental students are experiencing high stress during their training. And in their final years, and I found this really quite concerning, that many dental students are already showing signs of burnout. And to me, imagine starting your career and you're already close to exhaustion and burnout, and then find that you're moving into a role where that pressure isn't going to decrease. In fact, it's likely to increase in practice. So we know that students are now not only facing the pressure of the constant rota of examinations and assessment of their clinical skills, but they have to juggle the huge financial burdens that come with studying, unprecedented expectations to excel, and we hear reports of a toxic culture of constant peer pressure, and then the added challenges of ensuring that they've got sufficient patients to meet their clinical targets. And we hear students saying that sometimes they feel isolated and scared to ask for help because of fear of being seen that they're failing. I think if we look beyond the impact of personal impact of kind of the challenges on a clinician's health, the studies that we've seen also show how burnout and well-being impact the delivery of patient care. And although there's not a lot of research that is specific to dentistry, we have seen a lot of evidence in the medical space that equally applies to the dental profession. So there were two recent projects and publications that were funded by the MPS Foundation that showed how poor well-being and burnout is associated with more adverse events, so more patient safety incidents and lower professionalism. As an indemnity provider, from our perspective, that can drive more complaints and claims. But the consequence for the clinician then is further stress as they're subject to complaints and claims, and that undermines their confidence and further impacts their well-being. So I suppose just to kind of summarise, whilst our role as an indemnity provider is about supporting clinicians at the times of difficulty, our ethos and our goal is to actually help clinicians prevent the cases arising in the first place.
What role do you see dental schools, educators, and professional bodies play in ensuring the pledge has a real impact?
So our future dentists really need early support and tools to ensure that they're able to thrive. So rather than just surviving dental school. And one of the hurdles, and I mentioned earlier, needs to be overcoming that fear of seeking help, because students seem to be concerned that if they admit they're struggling, that might impact their training or their career. So I see the pledge as an important opportunity to shift the culture of dentistry. And historically, it's been one that prioritised resilience over our well-being, and moving towards one that recognises that actually a healthy clinician provides better, safer care. So all those organisations you referenced can play a role and deliver a message that seeking and asking for help is a strength, and it's something that will help to safeguard careers and deliver safer and better patient care. Sitting alongside that is ensuring that anyone who needs support can readily access tools and resources. So all those organisations, including Dental Protection, can look to ensure that resources are available, that our students are signposted, and that the material is relevant for dental students.
Looking ahead, how do you hope this initiative will shape the future culture of dentistry in terms of well-being and patient safety?
So my hope and the aim is to drive a change in culture. So it moves to a position of prevention rather than cure. If we increase our knowledge and understanding of the impact of burnout and poor well-being on the delivery of care, we can move towards normalising that looking after our own well-being is actually a positive step. So it's a crucial part of what being a professional is. And if you can embed that at the start of training, that will help to ensure that our next generation of dental professionals are far better prepared to move into the profession and can thrive in their careers.
Thank you for sharing such valuable insights into the importance of mental health and well-being within the dental profession. Your perspective highlights how supporting clinicians' well-being isn't just about individual resilience. It's about safeguarding patient care and the future of the profession as a whole. Thank you for watching, and we hope this discussion inspires more conversations about well-being and the shared responsibility we all have in shaping a healthier future for dentistry.